consultant breast surgeon, and of course the medical director at the Well Women Clinic, Dr. Houriya Kazim, joining us live on the sofa. Thanks so much indeed for being with us.
And thank you for having me.
I hope Dina didn't cause too much.
No.
Cleaned up after something like that. Good on
She
her.
did very passionately about
She said,
it.
you have patience.
Oh.
It's a clinic.
It's obviously October. We come together on this sofa to discuss Breast Cancer Awareness Month. Let's talk the awareness. If the awareness is one of the foundations and the fundamental elements of this the campaign throughout this month, is it getting through? Is it working? Are we seeing advancements, in the treatment of breast cancer, but also early detection, given the awareness that we've seen in recent years?
Yeah, I think so. I mean, some people think that, it's too much in October, but I think anything that sort of, spurs someone to go and think about it, or, oh yeah, I should go and have my checks, is important. And what I've seen in my short career is that it has changed. More people are willing to go and have themselves checked when they're absolutely fine, which was a very odd concept initially. People went to a dentist if they had a toothache, and so I tried to tell them, well, you don't wait till you have a car accident to put your seatbelt on. So now women actually will just come for checkups. So I've seen that change, and as a result of that, we are seeing things slightly earlier. We would still like to see it even more early, but we have other issues here in this part of the world where, because our women are younger, the breast tissue is denser, so it's harder to pick up a lump. And also, we tend to get more aggressive type of cancers because in the young you do. So we have our own sort of issues in terms of picking things up early, but generally I think the awareness is out there. And it's not just awareness per se, it is, I think it's making us or helping us to have those difficult conversations. In this part of the world, we don't even say the word cancer. You have to say it and then say a prayer to yourself after you say it, or you whisper it, or you call it that disease. Women now are having those conversations because cancer is so common. So, I think all of this is actually a good thing. I mean, we talk about it more, we'll do something about it, and then hopefully try to take away the fear that people in this part of the world have. As you mentioned, that you were like, cut it off, take it. So that's a very natural reaction that we see here. So, and that's because people are so fearful of the disease still.
And don't get me wrong, Dr. Houriya, I had a hairline fracture last year, I think exactly a year ago, and I couldn't be bothered to go to the doctor. I said it's going to heal itself. But as the story I shared some time ago, when I did feel that little bit of soreness in a specific spot on my breast, I couldn't get to the doctor fast enough because it is so scary. There's so much awareness, and I feel like it needs to be nipped in the bud. So I sometimes struggle to understand the psychology of the women who don't do that, but I understand that everyone reacts to panic differently. But I guess, what do you think is the biggest factor that stops them from coming forward and having this?
I think fear. I think it is fear. And I think fear makes, some people, fear will make you actually, be knocking on the door as soon as they found a lump. And then fear can do completely the reverse, where they literally just go into denial. I mean, I've seen women with huge masses going to work every day, obviously washing themselves every day, and just as if it's not there. And so that's the psyche, So fear is a big thing, and that's why I think, the awareness, the conversations, that's hopefully going to take away the fear. And also, with having survivors being much more open about it, because cancer survivors in this part of the world were a bit like disabled kids. They were always hidden away, or they hid it away. They never spoke about it, even to their close family.
So would you say that the slightest discomfort or unusual sight that you have, you need to run to the doctor and
it doesn't have to be like knocking on his door at 2 in the morning, but I think you can. I think, if something is persisting, and this is part of what I try to tell younger women, is just about knowing your body. So you don't want to freak out every time you have a pimple on your breast, but you want to know your body and you're like, that wasn't there before, or it was and I feel like it's slightly different to what I felt. So then yes, you want to do something. The thing is that the breast is a very dynamic organ. We tend to think of it as these two things kind of stuck on there, but they're two little miracle organs. You know, they literally take blood and make milk, you know, and the hormones that we produce every month affect the breast tissue. So it changes, and you're a woman, you know, it changes every month, right?
Yes.
So you have to kind of get to know, okay, well, this is this time of the month, so therefore my breasts usually feel like this. Or this is not that time of the month, and why are my breasts feeling like this, you know?
So it's knowledge of oneself is
Exactly. It's about just being comfortable with yourself and your whole body, not just your breasts. Because sometimes I think, you know, we treat the breasts and the breast awareness as a kind of a witch hunt, you know, like I'm going to get it before it gets me kind of thing. But it's really getting to know your body and everything about your body, what it looks like, what it feels like, and then obviously if there's any change, then you tell someone.
There are so many technological advancements, and AI is something that has entered every field, and science is no different to that. So I wanted to ask you, what are some of the latest AI 3D mammogram or any breakthrough treatments or machines available to detect this better?
So AI, I think, has been great, especially in my field. In some fields, I know people think they're going to lose their jobs, but with medicine, and in particular with mammography, so x-rays of the breast, where you have a radiologist who's reading that, and sometimes two radiologists, we're finding that AI is actually doing it better. And so many of the large centers in Dubai are already using AI in tandem with a radiologist. I don't think we're there yet to say we don't need radiologists. And the reason is that it's similar to when we first started doing breast MRI. Sometimes it's oversensitive. So what we're finding is that it's picking up phantom things, and then we end up going down a road of more investigations and more investigations. So it's not quite prime time, but it's getting there. And we also use it not just for reading mammograms, the pathologists use it. So when we look at breast pathology, when you have a biopsy, you know, what's a normal cell that goes into slightly abnormal and then a little bit more abnormal and then precancer and then cancer. You know, it's such a range or a grade of cellular changes, and it's literally pathologists eyeballing that. Well, AI can now do that for us as well, which is great, because we know that there's some types of breast pathology that literally, if you gave the same slides to 10 pathologists, 5 will call it this and 5 will call it that. It's actually very difficult to read breast pathology. And even in what I do in surgery, we're using AI for small tumors that you cannot see or feel. You can't see it with the naked eye, and we have a way of finding those cancers when it comes for surgery. We put wires in or other things that localize it, but AI can now do it for us in the operating room in 3D, which is amazing. So I kind of like AI.
I love technology.
Dr. Houriya, thank you so much for being here. Kudos to our production team for getting the best person for the job tonight. So stick around, and we're just going to continue on now.